Billions of dollars in healthcare spending. That's what's being discussed at a February 7th meeting between Prime Minister Trudeau and provincial and territorial leaders. But Vice Chief Heather Bair from Saskatchewan's Federation of Sovereign Indigenous Nations says First Nations leaders should be a part of any discussions around those dollars. That's because if healthcare funding is left solely to the provinces, many First Nations people and communities are neglected.
And I think when we talk about transfer payments and these kinds of frameworks, that impact us, whether it's negatively or positively, that's our role as leaders, and not to include us, any leader. Like we have the AFN, we have, regional organizations right across the country, and we have to stop this kind of practice, if we really want to be truthful and reconcilable.
And in Manitoba, Southern Chiefs Organization Grand Chief Jerry Daniels went even further. SCO put out a release today saying healthcare systems are in crisis and not meeting the needs of First Nations people. For Bair, those on reserve are especially vulnerable due to the long distances they have to travel.
Not to mention the problems and issues that First Nations are faced with when trying to access, their treaty right to health, being, the systemic racism, the discrimination.
Bair says she and others are dismayed by Trudeau's failure to include First Nations leaders.
Especially when the Prime Minister has indicated on his campaign that the First Nations relationship was the most important relationship, and of course, with TRC, Truth and Reconciliation, we feel this is insulting to have those discussions without our leaders.
Leanne Sanders, APTN National News, Winnipeg.